today we're going to be doing a postpartum assessment on Sarah. She just had a baby about 24 hours ago through vaginal delivery. So we're just doing our final assessment before she can go home. So I will just be doing my hand hygiene and providing privacy before I enter the room and introduce myself. So hi, I'm Nithya. I will be your student nurse today. We're just going to be doing a final head-to-toe assessment and ask you a few questions, and then you could be heading home with your baby. Okay. So we're just going to start by doing vitals, our temperature, BP. We're going to auscultate her lungs and heart, and we're going to do rest counts. So if she was a post-cesarean mom, we would be treating her like a post-surgical patient. So just keep that in mind. So so have you been having any visual disturbance?
No.
Any headache?
No.
And how did you sleep last night?
I'm pretty well, actually. I woke up a few times with the baby, but otherwise well.
Yeah, how are you feeling right now?
Good, a little tired, but good.
Tired, yeah.
Mm-hmm.
Are you having any pain?
Mild, maybe like a 3 or a 4.
Okay, and have you been taking the Advil or Tylenol that we left?
I'm just, the Tylenol, I was finding that was working better.
Okay, and how many have you taken?
Today I've taken 2.
Okay, sounds good. So we just, even though it's self-administered medication while she's in hospital, we do want to still be recording it on the MAR. So then we're going to be moving on to her breast examination. We would get her to participate and massage her breast till colostrum is present, and this is what we are doing the examination for. We'll also be palpating her breast tissue to make sure it is soft. And at this time, we could also do some education on engorgement, feeding style, and ask her if she plans to pump and give her some education on that. We also will be doing a nipple assessment to check for any chafing or cracking. If there was any signs of that, we would ask her to call us in next time she fed the baby to provide some support and education on latching and things like that. Then we would be laying her flat and doing a full head to toe. We'll be checking her bowel sounds, just like you do for a surgical patient, to assess for any paralytic ileus. We want to palpate, so we're checking the fundus, and so we would be starting at the umbilicus and kind of moving our way down, and we'd be providing education to kind of let her know how that feels and to let her know that it would be descending back behind the stomach as she continues to heal. And then we're going to assess her perineum and check for flow. We want to, obviously it's going to be a heavier flow because she is just 24 hours post-delivery. We're going to be just inspecting the area, and if she needs to have assistance changing a pad at that time, we would do that. If she had any complications or episiotomy or tearing, we would be assessing the incision or and also providing some teaching on incision care and just signs of infection that she could be looking out for as she heals. We want to do a full head to toe, just like any other assessment. We'd be checking her legs, and we'd be checking her dorsal and pedal flexion and pulses, and just making sure everything is healthy and she is able to go home. We want to check her eyes, mouth. We'll be checking her like her drift, and we'd be getting her to do that kind of assessment to make sure her nervous system is intact and everything is good to go. Before she does leave, it is important to talk about postpartum, just the season of being postpartum and signs of depression that she could be looking out for, and just how she's feeling about taking the baby home and just providing support in that. And it's also just important to encourage and empower her as she takes on this new role of being a mother. And that's it.
Sounds good. Thank you.